video production is intended to educate and empower preschoolers via easy reruns of the video in the preschool setting. This allows for continuous reinforcement of knowledge. On behalf of the ERHA and the organizing committee, welcome. It is a pleasure to see so many of you here. Prepare yourself to enjoy the video production. I thank you very much.
I have been asked to bring greetings on behalf of the ERHA. And I want to start by thanking all the members of the team, and we call it a team because we have incorporated all the various departments in producing this video for our preschool children. And it is a success story. And I say a success story because they started with going to the preschools and presenting the preschools with the information, valuable information, which the children would now take home to their parents. And because of sometimes because of adversities and challenges that we are faced with, we become very creative. And we recognize that we didn't have the staffing requirement to continue with this program, going to the various preschools. And out of that came a brilliant idea. Why not to do a DVD? And they were able to come up with a wonderful video that you're going to be able to view in a short while. Because I know they had challenging times, most times, but they stuck it out. And they continue to persevere. And today, we are proud as the Eastern Regional Health Authority to launch our preschool DVD. I also want to thank all the preschool teachers who are here with us as well for facilitating our program. Because without them, none of this would have been possible. So I want to thank you, all you preschool teachers who are here with us this morning. We know the Eastern Regional Health Authority is about promoting health. And we know we are boasting. We feel proud to boast about the wonderful job Eastern has been doing. And I feel proud here to stand here this morning.
A study published by the University of the West Indies on overweight children showed that they do have a high risk of developing diabetes and hypertension. And as you're aware, those are the #1 cause of death in Trinidad and Tobago. Heart, cardiovascular events, strokes, due to being overweight, having hypertension, diabetes, and one also major risk factor is smoking. In County St. George, 1 in every 4 children overweight, while the counties down south of Trinidad, it's even higher, 1 in every 3. It is therefore clear that childhood obesity is becoming an epidemic in our country. As such, the Eastern Regional Health Authority must be commended for this preschool video launch initiative. The Ministry of Health has undertaken a wellness mandate in an effort to reduce the plague of chronic non-communicable diseases in Trinidad and Tobago. As seen today, the Eastern Regional Health Authority are partners, or some of the regional health authorities have partnered with us at the ministry to combat the epidemic of chronic non-communicable diseases through obesity clinics and workshops. The Primary Care Child Assessment Unit at Barataria and soon at the St. James will accommodate referrals of overweight children.
I do apologize for the absence of the Minister of Education, but he has sent a good representative. Let me first begin by saying that it is indeed a pleasure to be part of this initiative facilitated by the Eastern Regional Health Authority. Upon hearing of the video launch, I was immediately reminded of one of the ministry's mission statements, the education and development of children who are healthy and growing normally, and this initiative is indeed an unparalleled step towards this end. Coupled with this is the Convention of the Rights of the Child that unequivocally states that all children have an explicit right to achieve and develop their potential and to sustain the highest possible standard of health. The preschool video production facilitates this goal in a manner that is not only appropriate but culturally relevant and no doubt will have a significant impact. It is alarming to note that in Trinidad and Tobago, childhood diseases are evident not only at a very tender age but is on the rise. I draw reference to the finding of the Diabetes Education Research and Prevention Institute that childhood diabetes has tripled in the past 10 years. Childhood diabetes have tripled in the past 10 years. On behalf of the Minister of Education, he wants to really get a nip in the bud, that booming soft drink trade at our schools. He is trying to encourage parents to think outside of soft drink. The preschool video launch is but one step towards the ultimate goal of healthy communities. Collaboration with our ministry as well as all relevant agencies would indeed ensure the success of this program. The adventures of Tina the Turtle would be an invaluable asset to the bank of learning aids at the ECC centers.
Being a part of the Eastern Region Health Authority has been an extremely good experience because we have always sought to promote the health and well-being of the population groups all along the life cycle, from the early childhood straight up to adulthood. And this morning we're looking at the launch of an initiative that focuses on promoting the health and development of the youngest sect. You know, we did a number of things in the Ministry of Health to help us to understand what we were facing as a country. We started putting together the evidence because we've moved past the days when we say, you know, I see this in the clinic and I see that in the clinic. We've moved from bringing it together, analyzing it, and looking for trends. And this is what you see happening here, because this is an evidence-based initiative coming to fruition. And when we looked at the whole of Trinidad and Tobago, we saw a number of things very worrying. The first one was the level of chronic diseases in the general population, where we have over 60% of deaths due to diabetes, heart disease, strokes, and cancer. Something that is not something we can sustain if we want a healthy population and if we want sustainable development. And we began looking backward. I will speak specifically about St. Andrew, St. David, where this video is being launched today. When we looked backwards and we looked at the population of children, we found that in St. Andrew, St. David, I will start nationally, 24% of children 5 to 18 are overweight or obese. But in some counties, obesity is not the only nutritional related health issue. In St. Andrew, St. David, you have a double burden of obesity and undernutrition. So in St. Andrew, St. David, you have almost equal percentages of children who are overweight or obese or who are underweight. And so for you, there is a nutritional crisis on both ends of the scale. And they're almost equal. They're just about 17.6% and about 18%. That's very, very almost the same. And so there's an imperative on our part as persons involved in health to look at the well-being of children. I want to commend the preschool sector in that without having policy you have tried to implement preschool by preschool individual policies where you say, bring water in the lunch kit. Put a juice in the lunch kit instead of a soft drink. Have a fruit, and I commend you. But unless we have policy that is at the national level, they are going to be fighting a very difficult battle. And so for the Ministry of Health, as well as the Ministry of Education, and both ministers have gotten together on this, we've worked together to develop a standard for food sold or served in schools. That standard is actually now completed, and the consultation is being planned for the first week in July. But I can give you a little preview, and the preview is sugary drinks, sugar-sweetened beverages that does not meet the WHO standard in terms of added sugar and how that impacts the healthy development of children will not be allowed for sale in schools. So automatically, one of the things that is recommended to be banned is soft drinks for sale in school or to be served in schools. And so we're working together as a sector to now start putting down policies and guidelines and SOPs that creates a supportive environment for children. And I come to where we are at today. I'm very proud to be here to stand, both as somebody who walked the streets in Beach and Plumita and Fishing Pond and Toko, as an officer who worked in this area. I'm proud to stand as a director on the board of the Eastern Regional Health Authority, and I served as a director for a number of years, and now as Director Health Education Division in the Ministry of Health, and highly endorse this initiative by the Eastern Regional Health Authority, and continue to say, keep up this excellent work that is founded in the evidence, built on sound strategic practice, and implemented by persons who are committed to work together in teams to support the health of the population of this region. Thank you very much.
Feedback from the principal from various schools have shown their support by verbally requesting the continuance of the health caravan, especially due to the positive behavior change exhibited by the children. Teachers indicated that children were practicing what they learned, as in the contents of lunch bags were fruits and water instead of sweets and soft drinks. In 2013, the Preschoolers Caravan for their hard work received the Eastern Regional Health Authority Quality Innovation Award for its ingenuity, creativity, and success in conducting a campaign which addresses the reduction of chronic non-communicable diseases. It is important to note that the Foundation for Lifestyle Diseases can be established as early as childhood. A quick glance at the Global Health School 2011 survey shows 30% of teenagers between the ages of 13 and 15 were overweight.
The Eastern Kingdom presents The Adventures of Tina the Turtle, starring Tina, Princess Katie, King Harry, Queen Mary, and Auntie Jenny, the fairy godmother.
Hello, boys and girls. I am Princess Katie, and I live in a big castle with my daddy, King Harry.
Love is something that you give it away, and must come back to you.
To present this to Glenda. She, well, you know, she would have been a colleague of mine, but she was also a student of mine, and I was her teacher and mentor. So it is really a proud moment, having gone through all that she's done, to present this to Glenda. Glenda, congrats. Excellent work.
To the initial puppet team, Miss Marilyn Medrick, Natasha Caton, Vanessa DeGans, Gemma Joseph, Inez Lyons, Joy Cruikshank, and Natasha Bellamy. Ladies and gentlemen, once again, I want to state that we are all most grateful to all who made this event a success. We thank you for being with us this afternoon. It's been a great pleasure. Thank you very much.